One of the most discussed concerns of both patients and doctors in the kidney world is the topic of high potassium, or what they call hyperkalemia. But what is the relationship of potassium to the kidneys, and why are doctors concerned when it gets too high? Today, we're talking all things potassium. What's up, San Antonio and world? I'm Dr. Qasim Butt, and I'm a kidney doctor, and I'm here to break down health in a simple way. On today's episode, we're going to bridge that gap in understanding between patients, primary care doctors, and nephrologists when it comes to potassium. Why it happens, what to look out for, and what to do to manage it. To kick things off, let's chat about how patients know if they have chronic kidney disease. The first thing we all need to be doing is to initiate screening for chronic kidney disease, particularly in those populations that are at high risk, those who are older, obese, have high blood pressure, and diabetes. Now, you can't really rely on just having symptoms of chronic kidney disease because kidney disease is typically silent until later stages of the disease. Signs that physicians should be looking out for in those later stages of kidney disease include, but are not limited to, swelling in the feet, hands and ankles, shortness of breath, loss of appetite, changes in urination, metallic taste in the mouth, fatigue, lack of energy, nausea, and more. Now, let's talk about high potassium. The proper terminology for this is hyperkalemia, or HK, where the serum potassium is greater than 5.0. This lab is routinely checked on most patients on just routine lab work and can be associated with chronic kidney disease, heart failure, and particularly those patients on dialysis. Why does high potassium happen? Well, it can be complex to explain, but let me put it this way. Your kidneys, your kidneys are a filter. They clean and filter your blood and balance all your electrolytes like potassium. As chronic kidney disease progresses or gets worse, that kidney function comes down, their ability to balance the electrolytes, including potassium, goes away. So instead of excreting potassium in your urine like you're supposed to, it accumulates in your blood. This is especially the case for those patients on dialysis because they often have no kidney function, and the only way to get potassium off their bodies is during a dialysis session itself. And on those days off dialysis, which is every other day, potassium levels in the blood can increase. Why should you care as a patient? Because a high potassium can possibly kill you. Yes, seriously. If the potassium in your blood gets too high, especially in the 6 or 7 range or greater, it can start to affect the electrical activity of your heart and cause cardiac arrest. The other reason you should care is that high potassium can make it difficult to take some of the most beneficial medications for your heart and kidneys. These include meds like ACE, angiotensin converting enzyme inhibitors, and ARBs, angiotensin receptor blockers, which are both quite common in this patient population. And both of which may have to be stopped in the setting of high potassium unless you find a way to bring that level of potassium in your blood down. So how do you manage high potassium? Well, one way is diet, meaning avoiding the foods that are high in potassium so that potassium never actually gets into your blood in the first place. Now, this oftentimes can be difficult because so many foods have potassium in them. This is where consulting a dietitian for recommendations can be crucial to go over the particulars of your diet. Some high potassium foods to avoid include avocados, bananas, oranges, potatoes, tomatoes, milk products, and more. You can see this is a long laundry list of items, including a lot of actually healthy foods. Oftentimes, diet modification alone isn't enough to manage hyperkalemia or HK because it can be too difficult or ineffective. So you may need to consider taking medications for long term to treat high potassium. This class of medications are called potassium binders. These are agents that I found to be very effective at treating hyperkalemia. The way they work is instead of using your kidneys to excrete potassium from your blood into your urine, they use your GI tract, which is your gastrointestinal tract. Potassium binders can bring potassium levels in the blood back into normal range, allowing you to go about your normal life and getting on the meds that are important to you. Well, I hope that helps explain the relationship between kidney health and potassium. Next time you're in your doctor's office, make sure to feel empowered to ask about your kidney function and your potassium levels. I always say bring a written down list of questions to ask the doctor. That way when you're in the office, you can make most of that appointment. Well, let me know what you think in the comment section below. And remember, it's your kidneys, your health.